Well, hello everybody. I think we can start. It is 2 o'clock, so let us start. And we would like to welcome you to the very first webinar of the joint action on addressing chronic diseases and healthy aging across the life cycle, JA-CHRODIS. We are Anna Gallinat and Anne Pearson from EuroHealthNet, the moderators for today's webinar. We will start by giving you some very practical general information. I don't know if maybe we can share the screen as well.
Yeah, it is.
Okay. So first of all, the Twitter information. You can follow us on Twitter, or you can also share information with your own followers on Twitter. You can use the hashtag chronic diseases, and you can use @EU_CHRODIS. For the interaction between during the webinar, you can ask questions from the chat panel on your right hand side. The idea is that we will mute all of you so that we are sure we don't have any dogs barking or whatever. We will mute all of you during the presentation, but you can ask the questions from the chat panel during the presentation, and then we will come to the questions after the presentation. We also need to inform you that the session is recorded. So if you don't want to be recorded, you should just mute yourself all the time. And finally, we will send an evaluation questionnaire after the webinar. It will be sent by email tomorrow morning. Now, let me come to introduce our featured speaker for today, and let's get to the content. Our guest is Carlos Segovia. Carlos works at the Directorate for Research, Evaluation and Promotion at the Institute Carlos III in Madrid, in Spain. And Carlos has this huge task of coordinating the whole joint action. That means that he's coordinating over 70 partners, and at the same time he tries to makes the governing board of the representatives of 25 ministries of health happy. Today he's going to give you an overview of the joint action, how he manages to make us work all together, and the achievement that the joint action has made by today. So Carlos, this is now over to you.
Carlos, we can hear you now, I think.
Yeah, okay. Thank you very much for the presentation. Yes, I'm Carlos Segovia. I'm working at the Institute of Health Carlos III in Spain, Madrid, and trying to present to you the general overview of this big joint action about chronic diseases. This is this is the topics we are trying to explain to you briefly, beginning with some basic information about this joint action, what is exactly a joint action here in Europe, some of the figures and the challenge we are facing in chronic diseases, and then going more description of this joint action, what we do, what we try to do, the objectives we have, and some of the results we already achieved. So some background information about the joint action. Yeah, joint action is a kind of special kind of project financed by half by European Commission and the other half by member states. So we have to contribute with so-called in-kind work and contributions to the project, and half of the budget is provided by the European Commission. This time DG Santé, it's not research, is the Director General for Public Health in the European Commission. This is part of financed by the Public Health Program, which defines priorities for the whole financial period of 7 years, but each year publishes an annual work plan, and this joint action was prioritized 3 or 4 years ago in this health program. This is a common action between the European Commission and Member States. So it is up to Ministries of Health to designate who is really taking part in the project, so being active in the project and signing the contract with the European Commission to perform the project. And so we are under the authority of our national ministers of health. And of course we have to demonstrate that this joint action has added value at European level, and it makes some contribution at European level and not only summing up independent national initiatives. We can go to the next slide. Yeah, some of the figures, some of the data that give us some feedback of the problem we are facing and why chronic diseases are so important here. You can see some of the figures we are managing. So chronic diseases is one of the leading causes of mortality in Europe, and prevalence and incidence is rising. Most important chronic diseases account for many of the burden of the disease in general, of all diseases in Europe, deaths and morbidity also, and they affect the majority of people over 65 years old in Europe. And it is not only the case that this population suffers from chronic diseases, but also that many of these people suffer from several chronic diseases at the same time, which adds some complexity to the situation, to the health situation, and also some complexity to healthcare institutions, health systems in general, to address this type of problem. So we can pass to the next one. Of course, they have a great influence in the quality of life of people suffering from chronic diseases. And for example, there has been a European initiative to bring up innovation in Europe facing healthy aging, and chronic diseases is one of the most important problems they face in this partnership, in this initiative. So this is related to the burden, but we know also that many of the chronic diseases are preventable, so we can retard their onset and try to concentrate these chronic diseases in the last years of life rather than suffering them for a long time. Healthcare budgets are highly dependent on chronic diseases because they consume a great part of these healthcare budgets. So in terms of sustainability of health systems, it is also very important. This type of diseases are very, very important. The treatment and management of these chronic diseases is increasingly complex, but there is room for improvement in terms of efficiency and also effectiveness. This is the kind of ideas that we manage as a general background to the joint action. And if we go to the next slide, we can define then what is the objective of this joint action. And the objective defined in most general terms, is to promote the exchange and also transfer of good practices between European countries and regions related to chronic diseases, so that we can use these practices as an inspiration or a background to define better health policies and interventions regarding these chronic diseases. This is the most general objective that we can define for this joint action. Next, please. This general objective is then spelled out in different areas of work, and regarding health problems, we define three main fields. One is health promotion and prevention. The second one is multimorbidity, and the third one is diabetes, and we take diabetes as a case study to synthesize all the outputs or the results we work in this joint action. Next one, please. So this is a big joint action. Normally joint actions not so big as this one. We have partners from 25 countries. In total we have 39 associated partners. This means that they contribute with their own resources, but that they also receive funding from the health program. So that means that for each of the 25 countries there may be more than one associated partner. And then we have 32 collaborating partners, meaning institutions that collaborate with the project but don't have any contract with the European Commission, so they are not obliged to contribute. They don't have a commitment, upfront commitment to contribute to the project, but they can do it freely under their own limits and however they want to. We divided our work in seven work packages and 30 tasks, and well, the total budget is 9.2 million euros for 3 years of duration of the joint action. And let me see, because I don't see now what is in the right sound. Only to mention that here at the Institute we are leading, we are coordinating this project, and on behalf of nominated by our Ministry of Health in Spain. Next one, please. Yeah, this is a kind of a description of the type of partners we have in this joint action. Many of them are public health institutes. It's also relevant the number of universities we have here, but also NGOs, representatives from National Health Service, etc., public foundations, even hospitals. So there is a variety of different institutions, all related to health, obviously, and mainly public health, or with a bias towards public health, but really very different type of institutions. Next one, please. We also have identified a number of stakeholders, meaning people that could be interested in the progress of the joint action, and especially on the outputs and results of this joint action. And here you can see as a model, as a way of looking at that, the distribution of these stakeholders across Europe. You see there is a great concentration in UK, but also Brussels, Spain, Germany. So we here include national institutions, but also European associations or European NGOs in the field of public health. Next one, please. Yeah, and this is the distribution of work we have done. We have 3 horizontal work packages, meaning the work package on coordination, the work we do to disseminate this joint action, and also the evaluation of the joint action in general. We have then 4 more, so to say, operational work packages, including one which is dedicated to the development of a platform that we want to use to exchange knowledge, but also exchange practices. Then we have a thematic work package on prevention and promotion. Then another one on multimorbidity and how to address this problem of multimorbidity. And the last one in this row about diabetes that we, as I said, are using as a case study. This is the distribution of work, which means how we frame and how we address, in general, the whole field of chronic diseases, how we define specific fields to address chronic diseases. We have what we call a governing board, who are representatives of ministries of health, obviously from the countries participating in the joint action, initially at least. We go there to this board and we inform them about our activities, our outputs and results, and they give us feedback and also institutional or policy orientation depending on what we are discussing each of the meetings. Then we have also an advisory board, people that we assume are experts in these fields, and again we ask them to provide us feedback on the progress and the outputs and results of the joint action. So it's a kind of, so to say, complex, because this structure has not been proved before this joint action. This is the first time we have a governing board. It's normal to have an advisory board, but not so normal to have a governing board. This was the first joint action to have such a thing, but we wanted the ministries of health to be really committed and involved in the experience of this joint action. Next one, please. Yeah. So how do we see, how do we frame this exchange and possible transfer of good practices? So we got some sources where we go to identify good practices. One of them is this initiative I mentioned before, which is the European Innovation Partnership in Active and Healthy Aging. There is a source. This is a source of good practices. There may be other sources, like, for example, the literature. So there was a discussion within the joint action. What do we call? What do we understand as a good practice? And for the moment, the closest we get to a definition is we admit some contents of or results of our documents we can find in the scientific literature, including maybe clinical guidelines of this type of documents, but also practices describing what people do in the daily work, so in normal life. So both type of sources we use, and then this is analyzed and taken by the thematic work packages on prevention, promotion, multimorbidity, or diabetes. And then we identify like a list of for potential good practices. If they are describing what people do in the normal working life, in the daily activities, then we have to identify or to define some quality criteria to call them really good practices. And this work has been done in one of the work packages, in work package 4, in collaboration with all the rest. And they have defined a list of quality criteria for, again, prevention promotion first, second for multimorbidity, then for diabetes, and a fourth one related to patient empowerment. So we have some criteria agreed by a number of European experts and using a Delphi methodology, so that we can use this criteria to evaluate the practices, real-life examples of practices according to this agreed criteria, and then say, okay, this is a good practice that we can upload in the clearinghouse and make it there available for any professional to inspire new ideas or to try to transfer this practice in their own context and their own. Next one, please. So we define kind of a list of steps that we could take to transfer finally good practices. First of all, define quality criteria or identify recommendations for good practices. The second one is identifying potential good practices from real experiences of health professionals across Europe, then putting them in the platform so that we facilitate the exchange of practices across different professionals, across different regions and countries in Europe. Then we can promote this exchange by providing some advice or support to make the transfer, to describe the practice, etc. And then finally, ideally, transferring practices from one setting to another in Europe. Yeah, the next one, please. So what we have in total is what we have already now is a series of good practices in health promotion and chronic disease prevention. We have defined recommendations on how to effectively approach multimorbidity and define a kind of model on how to do that better. Then we have defined quality criteria, but also recommendations on how to develop national plans for diabetes. And we have developed the platform that makes this exchange work. First of all, presentation and description, and then evaluation, and then exchange of these good practices across Europe in what we call the JA-CHRODIS platform. Next one, please. And now commenting on the achievements. Well, we have a number of good practices, as I mentioned, in prevention and promotion. And there was a team of the group of people dealing with prevention and promotion. They selected a number of countries that could be considered probably the better examples or the better good practices in this field, and they organized study visits so that they could really assess well, first of all, they could really better describe what is the practice about and how it is performed. Then during the visit, asking or trying to figure out what could be the essential element that made the experience or the practice successful, and also trying to assess whether or to what extent the practice could be transferred to a different place in Europe. As I said, we have defined 4 different list of quality criteria to define a practice as a good practice, and this is in the fields of health promotion, prevention, multimorbidity, which is mainly focused on organizational interventions or organizational changes that have to be implemented to address multimorbidity effectively. Then we have the quality criteria for practices on diabetes, and then we have the quality criteria for practices on patient empowerment. This is the second bulk of results. For multimorbidity, apart from discussing the quality criteria, they have defined we are proposing a multimorbidity care model defined in a number of components that we think are essential to provide high quality healthcare to people with multiple chronic diseases. We are also identifying training programs for case management in this type of patients. And in the field of diabetes, we have produced a policy brief on diabetes after analyzing the situation of diabetes plans across different European countries. Next one, please. In multimorbidity, the model and the training program has been informed also of by a review on the existing pathways or care models for multimorbidity, for multimorbid patients. And as I said, the policy brief has been also informed by a review of national diabetes plans across the majority of European countries. There is also data on strategies and recommendations for the secondary prevention and management of chronic diseases. And as I said, the quality criteria that this is uploaded are uploaded for the use of the performance of the platform. We have developed the platform so that we have something that could be used by health professionals, and not only healthcare professionals, but also professionals involved in prevention and promotion, so public health departments, for example. It could be used also by patients, by researchers, and also by decision makers. There's a source of information and examples of practices that can be used by decision makers or policy makers in different countries, inspiring them for new ideas, or just probably promoting just the transfer of the better option they find there to their own setting using the platform. Next one, please. And I think this is the last. With all these outputs, we are organizing dissemination activities and trying to disseminate our findings and trying to promote the use of our outputs. And I want to mention that our final conference will be by the end of February next year in Brussels, and then we will have the presentation or review of our outputs and our results, but we will put all that within greater context of what is happening related to chronic diseases at European level, but also in a sample of different countries, so that we can have a overall idea of what's going on related to chronic diseases across Europe, and what could be the role or the contribution of this joint action within this more general context. And I think this was the last slide, before the disclaimer of the explanation that we have been funded by European Commission and so on. I think, if I understand well, that we may open now maybe for attendees to make questions. Is that right?
Yes, that's correct. So thank you very much, Carlos, for this overview. And we have now unmuted, or we are going to unmute all the people, so so that people can, again, either send by chat or ask the questions.
Okay.
Do you have questions, people? Attendees.
Yes, may I ask a question? Can you hear me?
Yes.
Yes.
Okay. Yes, I'm Ursula Kirchmeier from Rome in Italy, and we have very recently become a reference site of the AAP and AHA. And for me, it would be interesting, for example, to know which good practices you collected, and among the good practices you collected, for example, from EIP, which ones were evaluated positively and which ones maybe not. So is there the chance to have this information?
Yeah. Basically, because it's very simple. We all the time of the duration of the joint action, we have been in contact with the European Innovation Partnership. We know they have been collecting also practices, but not following, obviously, our format, so to say. So now we know that they are more systematic in the way they are collecting practices. And we have already contacted them, especially, if I remember well, the group B3. I'm not totally sure, but I think it's group B3.
Yeah, that's chronic diseases, yeah.
Yeah. And then what we will do, because we know they are now being more systematic, we are approaching them to invite people that is uploading or contributing with the practices to the repository of the European Innovation Partnership, inviting them to also upload them in our platform. But this is still being explored, so we don't have still any of the practices their practices in our platform.
But is your platform public?
Yes.
Okay.
But
It's public. Let me say that it is still in being finalized. We still have to finalize the way we are managing that and how do we open access to external people. But this will be finalized very soon, so that for the moment we got only the partners of the joint action able to upload their practices there. But in very soon it will be open to anybody that would like to upload their practice.
Thank you.
Welcome.
Are there other questions?
Will this presentation be available to us? Can you send it to the participants?
Yeah, we can do that. And we have been recording the video, the presentation and the video, so it will be on our YouTube channel as well. But we can also share it among the participants together with the evaluation link. And
that would be nice.
On the website as well, yes.
Thank you.
I guess you all know that this is the first of a series of webinars. So in the next sessions we will be able to go deeper in each of the parts I've tried to explain to you, so that you can have more detailed information in the following sessions.
That's correct. The sessions are every Tuesday of October. So next Tuesday will be on health promotion and disease prevention. Then the week after we will have the webinar on multi-mobility. And the week after, the 25th, we will have on diabetes. It's every Tuesday at 2 o'clock.
Sí, Fernando.
We'll receive the link on the Monday before. I guess if there are no more questions, you can still send us questions by email, and we can forward them to Carlos. And otherwise, I think we will close this webinar here. I would like to thank everybody for attending the webinar and for taking the time to listen to Carlos and to view the presentation. As we mentioned, that will be on our website and on different channels. And we to see your names next week then for the following webinars. Have a great end of the afternoon, and thank you very much.
Thank you.
Thank
Thank you.
you very much.